Hello, I'm Dr. Mai Sharaf, and I am the internist with Continuum Internal Medicine and Pediatrics. And I wanted to put this video out there so that everybody could know and be aware that I now have a new partner in the practice, and that is Dr. KellyFELPS. And so Dr. Felps and I have gone back to 2005 when we first met. I moved here actually from New York State and joined a clinic in downtown Fort Worth, and he was the first doctor that I met when I moved to Texas. And we actually practiced together for a year in that clinic. And he was a saving grace for me. Showed me the ropes, and just got me familiar with the clinic. And I had been in ER medicine for about 5 years. So just meeting Dr. Felps, he helped me transition back into internal medicine as the outpatient world. And so I'm gonna let Dr. Felps talk a little bit about himself because he's been in this part of Texas much longer than I have.
Yes, I've been in practice in my hometown basically since 1985, and I was in private practice for 9 years prior to going to work for the county and the medical school. And so it's been a good transition. May and I got along well when she came into town, and we have a similar view of how to practice internal medicine. Try to take a good history, spend some time with the patient, and then decide what's in that person's best interest. And so it's been a good
Definitely a good
partnership.
fit.
Yes.
I mean, I think that both of us truly feel the same way, that when you come and see us in the practice, the patient will always come first. And so we want to make sure that we spend enough time with the patients in order to ensure the best quality of care that we can provide. And you'll always be able to have our ear. And as we make a really good partnership, because we both still believe in those very simple, common values with patient care that seems to be getting lost in this day and age of computers and software and quotas. But our goal each day coming to work is taking the best care we can of the patients. And I think the best part of our jobs, what do you think?
Well, I have a natural sense of curiosity, and so I enjoy problem solving, and to take the history and try to determine what's happening and then do a reasonable workup and try to make sure the patient understands what's going on. To me, that's satisfying, and of course trying to help someone.
I think that if a patient leaves the clinic and they really don't have a really good understanding of their medical diagnosis or their treatment plan, then we in some way have failed. And so again, I think that one of the other real big important parts, and I know Dr. Felps feels the same way I do, is that we may see them for 15 minutes, but we play a big part of our patients' lives. And I think that actually a lot of the, a lot of our pluses in our job is that we can make a difference in people's health and well-being. And as internists, we take care of 18-year-olds on up. So we've taken care of generation after generation after generation of family members, which is a huge plus to our practice. And so again, I'm very proud to have Dr. Felps join me. And I feel that the both of us practice medicine in the same way, which I think is becoming a very unique quality these days. And so we'd love to see you and come join our family and our great staff who also feel the same way we do and have the same, I think the same priorities when it comes to patient care, which makes us a really strong team, and I'm very proud of our practice, and we'd be very happy to see you here.